That's what I need. Hey guys, welcome back to my channel. My name is Katie. If you have been here before, thank you for coming back, and if you're new, please go down and subscribe. Let me tell you why subscribing is so important, especially to me. I'm trying to get monetized, and basically my goal is 1,000 subscribers, and I think I'm like a little bit more than halfway there. Yeah, I'm gonna need your help to reach my goal, so please go hit that subscribe button. So I came up with this idea that I basically wanted to add like a segment or whatever you want to call it into my channel where I focus on PCT, which is patient care technician. So I'm adding this into my channel because I took a course over the winter break on patient care technician, and I just decided I wanted to share it with my subscribers and hopefully new subscribers that want to know more about PCT. The first question is, what is a PCT? This is also patient care technicians, and a patient care technician is basically a health provider that works under the supervision of a nurse. So if any of you guys have ever been to a hospital, long-term care facility like a nursing home, you probably see the people that draw blood, do EKGs, fix a bed, like make a bed, bathe patients, feed patients, all of that. Those are more likely PCTs. So PCTs get a lot of direct patient care. PCTs are basically also like phlebotomists. So the only way that I see that you're not getting like direct patient care is if you work in a lab, like a blood bank or something like that, and you're not talking to any of the patients or the clients. You're just in the back, like in the lab, running tests and doing things like that. So PCTs assist with ADLs. So PCTs assist with ADLs. ADLs are activities of daily living, and this includes basically anything and everything someone needs to survive. So this is like bathing, feeding, like helping to go to the bathroom, transferring from a bed to a wheelchair, ambulation, anything really, nail care, feet care, mouth care, all of that. All right, second question, how do you become a PCT? All right, I'm gonna try to just make it easy to understand because it sounds like a lot, but it's not that much. So the main thing to know about becoming a PCT is that you need a high school diploma or a GED. So if you have that down, that's great. Your next step would be to look for a training facility anywhere near you and just sign up to take classes there. So this is how it works. To become a PCT, you need to be a CNA first. You need to be a certified CNA first. So if you're already a CNA, all you have to do is take phlebotomy and EKG classes and boom, you're a PCT. But if you're not a CNA, which was my case, I took an advanced track program where they gave me the CNA classes 1 month and then the PCT classes the next month. So it was like a 2-month program type of thing. So all you really need to do is pass your training, like your CNA classes. This is the portion that teaches you about ADLs, the activities of daily living that I was talking about. It teaches you how to perform them, any signs that need to be reported to the nurse in charge or whatever. They teach you all of that, and then you basically just take like a midterm and a final. You pass, then you're good. They also do clinicals where you have to go in to a nursing home. It's basically like volunteering. You just go in for, mine is 4 days, so I do it for 2 weekends, like Saturday, Sunday 1 week, Saturday, Sunday the other week. That's 4 days. I basically just volunteer, help out, see the activities of daily living like in person, see another CNA do it, me ask questions, me also perform it. So that's the CNA portion. Once you're done with all of that, then you move on to the phlebotomy and EKG portion, and you basically just learn all about phlebotomy, all about EKGs, and then you also have to perform them. So once you finish your CNA side and you're done with all of that, you took your test, you passed, all right, great. Now you're on to the phlebotomy and the EKG side, and basically at the end of your class, you will take a final 4-year class. Then you pass that, great. After that, you have to apply to take your nationals. So for me, I applied through NHA. And yeah, basically you just set a date to take your PCT national so that you can get licensed. So that's basically like a quick summary of how do you become a PCT. Also keep in mind that you do have to pay for these training programs. At least the ones I was looking at all involved money. I took my training course in the Bronx. I can also link that down below if any of you guys are from the city or like anywhere near me and you guys want to go to that specific one, then I could go there. But yeah, it was pricey. I think I paid like $3,000 for the class, but they give you like all the textbooks, all of that. How much is the hourly pay? Okay, so I'm only gonna talk about New York State. I don't really know about any other place, but I know that here the range is from 15 to 25 or 26. There's not really like one set number I can give you, but there is definitely a range. And Honestly, when I was looking at jobs to apply to, most of them were in the 20s, like 21 an hour, 22. I think the lowest I saw was like 19. All right, now I want to tell you guys the 5 patient care skills that you have to know to become a PCT. So number 1 is taking vital sign measurements. So this is taking someone's temperature, blood pressure, pulse, respirations, all of that. So these are things that you will get taught in whatever training facility you go to. So don't think that there's something wrong if you don't know how to do that now, because I didn't know how to do none of those until I got trained to do that. All right, number 2 would be soft skills. And basically soft skills is, how do I say this? It's everything that you don't get taught. So it's more so about like the characteristics that you should have when you're dealing with direct patient care. So this is like being responsible, being patient, being empathetic, being a good communicator, being able to listen to someone, you know, all of that. There's definitely more, but those are the ones that just popped up into my head. Number 3 is anticipate need. So what this means to me is that when you're working with patients, generally they're not going to tell you right away that they need help with something, especially like those that are trying to, you know, prove to themselves that they can still do things by themselves, which is great. Like if they can, then that's perfect. But most of the times they do need some type of help. So just anticipate need. Always go back and look at your patients, ask them if there's anything that you need after any type of procedure. Honestly, just whenever you go into the room, the last thing you should say is like, do you need anything else? Do you need me to do something? Whatever it is, just anticipate need, because most of the time they definitely need something, and I feel like they're more likely to tell you if they see that you're really like trying to be as helpful as you can. Number 4 is ADLs, like I mentioned at the beginning of the video. So ADLs is activities of daily living. And yeah, you just have to know how to bathe, feed, transfer ambulation, perineal care, feet care. There's so many cares. I can't even name all of them. But that is all things you will get taught. So you do not need to go searching up how do you do this, how do you do that, because honestly, you're not gonna know how to do it. Honestly, like I was given a packet of how to perform these activities of daily living, and honestly, I was like, what? Like I didn't even understand until I saw it being done. So you have to be able to know how to shave them, how to bathe them, whether it's in a bathtub or whether it's a partial bath in their bed while they're still laying down. There's so many things that go on in activities of daily living. Just think like everything that you do for yourself, you will have to do for somebody else. And then number 5, of course, is phlebotomy and EKG. You have to be able to know how to draw blood from various locations. Like sometimes people have really bad veins in their antecubital fossa. That's this area right here, right? This is like where you normally get blood drawn from. Some people have bad veins. You're not going to be able to get a vein in this area right here. So you can go like right here. I don't know if you guys can see, but yeah, we have like these veins right here that you can go into. You can also go in through like this area. So you also have to know how to do dermal punctures, and those are like the ones that just like little, you know, like a little stab right there on your finger, and then like the blood just starts dripping down. Yeah, you have to know how to do those on the heel and on the fingers. So you do need to know how to perform EKGs. These are electrocardiogram tests, and it's a easy, painless procedure where you just apply like electrodes on the body. They're gonna tell you like where exactly on your body, and you just have to know how to problem solve, because most of the time there's like little things that interfere with the machine, so you won't be able to get like accurate results if something interferes. That could be like the skin of the patient was too oily, or one of the electrodes, lied, one of the leads, that's one of the wires, is like broken. The point is that you have to know how to run these tests, and also you will get taught how to do that in school in your training program, so you don't have to worry about none of that right now. I basically covered like the basic things that you need to know before becoming a PCT, and if you guys have any questions, you can leave it in the comments. If you guys want me to make another video going into more depth or answering other questions, or even performing like certain procedures that you guys want to see, it could be ADLs, it could be phlebotomy or EKG, whatever you guys want. I'm certified, so I can do all of that. And also remember, if you have not subscribed to my channel, go down and please support me. Hit that button. If you liked my video, also give it a thumbs up, and remember to leave any comments down below. I'll answer any questions you guys have. And yeah, thanks for watching my channel, and I'll see you guys next time.